Hello, cherished friends, and a truly warm welcome back to Wellness Hub Seniors, your trusted source for insights into living your most vibrant, healthy life after 60. Every year, millions of seniors diligently attend their routine checkups, firmly believing they are taking the most responsible steps for their health. Yet, what if a startling truth were revealed, that some of these very tests, intended for your well-being, might actually elevate your risk of stroke, potentially even overnight? It sounds incredibly difficult to accept, doesn't it? You place immense trust in your doctor. You meticulously follow every single recommendation provided. However, subtly hidden within the intricate layers of modern medical practice are silent, often overlooked risks that no one explicitly warns you about. These critical warnings are not found in the daily news. They are absent from the glossy brochures in your clinic waiting room. And, astonishingly, sometimes, even your trusted physician may not fully disclose them. Picture this scenario. You walk out of your annual checkup, feeling a sense of reassurance that everything is perfectly fine, only to suddenly experience unsettling dizziness, alarming blurred vision, or something far more severe, just a few days later. You are then left grappling with profound confusion, desperately wondering what could possibly have just happened. Herein lies the profound truth. Certain diagnostic tests, especially when they are performed with excessive frequency or under specific, pre-existing health conditions, possess the quiet potential to trigger sudden, dangerous spikes in blood pressure. They can subtly disrupt the delicate balance of blood flow throughout your system, and in the most concerning instances, even initiate a perilous chain reaction that could ultimately culminate in a debilitating stroke. However, please be reassured, this discussion is not intended to instill fear or anxiety within you. Its sole purpose is to empower you with crucial information. It aims to equip you so that you can confidently ask more pertinent and insightful questions during your medical appointments. This knowledge is designed to enable you to proactively protect both yourself and your cherished loved ones. Because, especially after reaching the age of 60, the focus shifts beyond merely detecting health problems in their early stages. It becomes equally, if not more, vital to actively avoid those potential issues that we might, quite inadvertently, cause ourselves through seemingly routine medical procedures. In the next few minutes, we will meticulously uncover the 5 most common medical tests that, despite their routine nature, may carry these hidden risks of stroke, particularly for the senior population. More importantly, and perhaps most reassuringly, you will gain precise knowledge on how to effectively safeguard your health and well-being before your very next medical appointment. If you are currently over the age of 60, please take a moment to drop a 1 in the comments section below. If you are not yet 60, kindly drop a 0. And, crucially, make sure to subscribe to Wellness Hub Seniors, where our unwavering mission is to reveal the truths that others might hesitate to share with you. The hidden risks of routine medical tests now. Let us delve into the very first test, about which you should exercise considerable caution and perhaps think twice before undergoing. If you have ever experienced a CT scan that involved the use of contrast dye, you might vividly recall that distinct, warm, and often flushed sensation that spreads throughout your entire body. That sensation is the contrast dye diligently performing its intended function, meticulously helping your doctor visualize your intricate blood vessels, internal organs, and various tissues with significantly enhanced clarity. Sounds incredibly beneficial and helpful, doesn't it? Yet, here is a critical piece of information that many seniors are regrettably never fully informed about. That seemingly small injection of contrast dye can exert a far more profound impact than merely enhancing diagnostic images. It can, quite subtly and unexpectedly, impose significant stress on your delicate cardiovascular system. This risk is particularly heightened if you are over 60 and are already managing pre-existing conditions such as high blood pressure, various heart problems, or compromised kidney function. For some individuals, The contrast dye can trigger what is known as a vasovagal reaction, characterized by a sudden and alarming drop in both heart rate and blood pressure. This physiological response can manifest as uncomfortable dizziness, debilitating nausea, sudden fainting spells, or even brief periods of unconsciousness. However, in other, equally concerning cases, the exact opposite physiological reaction can occur. Blood pressure can surge rapidly and dangerously, causing fragile blood vessels to constrict or even go into painful spasm. When such an event transpires, the insidious risk of a stroke or a severe cardiac event quietly, yet menacingly, begins to creep in. A significant study published in the esteemed Journal of Vascular and Interventional Radiology provided compelling evidence that older adults who underwent contrast-enhanced CT scans exhibited a significantly higher incidence of vascular complications within a mere 72 hours following the procedure. This finding was particularly pronounced in those individuals with a documented history of hypertension, pre-existing cardiovascular disease, or any degree of impaired kidney function. In essence, the more vulnerable and compromised your physiological system, the more inherently dangerous that contrast dye could potentially become for your health. Allow me to share a poignant real-life case to illustrate this point. An 81-year-old gentleman presented for a routine abdominal CT scan after experiencing some relatively minor digestive discomfort. The scan results were reported as entirely normal, and he was discharged home, feeling perfectly fine. However, just 2 days later, he tragically suffered a minor stroke. The most probable cause, as determined by medical professionals, was that the contrast injection may have temporarily, but critically, spiked his blood pressure, thereby causing a small clot to form and subsequently block the vital blood flow to a specific part of his brain. This narrative is not intended to imply that CT scans with contrast are inherently bad or should be universally avoided. Quite the contrary, these powerful diagnostic tools can detect life-threatening conditions such as various cancers, dangerous blood clots, and potentially fatal aneurysms, conditions that, when identified early, can undoubtedly save lives. However, the crucial takeaway point here is this: these scans should be utilized with profound wisdom and discernment. They should not be indiscriminately ordered as a mere component of a routine checkup, simply just in case. So, what proactive steps can you take to effectively protect yourself? Before you consent to undergo a CT scan with contrast, engage in a direct and informed conversation with your doctor. Specifically ask, is this scan absolutely essential for my current condition, or is there a safer, equally effective alternative for someone of my age and with my specific health profile? Be sure to share your complete and comprehensive medical history, paying particular attention to any pre-existing conditions such as high blood pressure, kidney disease, heart conditions, or any previous adverse reactions you may have experienced to contrast dyes or certain medications. Always, without hesitation, inquire, can we perform this procedure without the use of contrast? In many instances, a non-contrast CT scan or a simple ultrasound examination can provide sufficient diagnostic detail without introducing the additional, unnecessary risks associated with contrast agents. Understanding the stress test coming up next, we will explore another common medical screening that many seniors routinely undergo, even when they feel perfectly healthy and symptom-free. This test, despite its seemingly benign nature, may not be as harmless as it initially appears. Let us now turn our attention to the stress test, also widely referred to as the exercise stress test. On paper, this procedure appears to be an intelligent and logical diagnostic approach. It involves attaching a heart monitor, walking on a treadmill, and meticulously observing how your heart performs when subjected to physical pressure. However, if you are over the age of 60, and especially if you have high blood pressure or pre-existing heart conditions, this seemingly straightforward test could potentially become quite risky. Here's a detailed explanation of why. During the course of the test, you are instructed to walk or even jog on a treadmill, while your heart rate and rhythm are continuously and closely monitored. As the speed and incline of the treadmill progressively increase, your heart rate rapidly accelerates, your blood pressure rises, and your entire cardiovascular system is suddenly placed under intense and considerable strain. For a healthy 30-year-old individual, this might pose no significant problem whatsoever, but for seniors, particularly those with pre-existing conditions, it can be likened to lighting a fire near dry brush, potentially triggering serious and unforeseen complications. Some of the inherent risks include dangerous and sudden spikes in blood pressure, the onset of sudden arrhythmias or irregular heartbeats, and in rare, but undeniably real cases, the occurrence of small, delicate tears in fragile blood vessels, particularly those located within the brain. A comprehensive 2020 study published in the American Journal of Cardiology meticulously examined over 1,300 patients above the age of 65 who underwent treadmill stress tests. The alarming results revealed that nearly 7% of these patients experienced harmful events during the test itself. These events included significant blood pressure surges and the development of abnormal heart rhythms. The group most profoundly affected was consistently identified as those who already had vascular issues. And this is not merely theoretical, it is a stark reality. One of our dedicated subscribers, Margaret from Ohio, graciously shared her personal story. She is 74 years old and has bravely managed high blood pressure for many years. Her doctor recommended a stress test simply as a routine check-in. Halfway through the treadmill portion, she began to feel unsettling dizziness and a distressing tightness in her chest. The test was immediately halted, but by the very next day, she tragically suffered a minor stroke. Doctors believe that a sudden and severe rise in her blood pressure during the test may have caused a tiny vessel in her brain to rupture. To be absolutely clear, the test itself did not directly cause the stroke, but it undeniably introduced a significant level of stress to an already vulnerable physiological system, and that is what tipped the delicate balance. So, what is the crucial takeaway from this information? Engage in open and honest dialogue with your doctor. Ask, is there a safer, equally effective method to evaluate the heart? In numerous cases, alternative diagnostic options, such as a nuclear stress test, which employs medication to simulate the effects of exercise, or a resting echocardiogram, may present considerably safer alternatives for seniors. Furthermore, if you are not currently experiencing any concerning symptoms, such as chest pain, shortness of breath, or persistent fatigue, inquire whether the test is genuinely necessary at this precise moment, or if it can be safely postponed. The endoscopy. When caution is key coming up next, we will explore another routine medical test that, while seemingly harmless, could potentially come with hidden risks if you are not sufficiently cautious. Let us now discuss a procedure that has become remarkably routine, especially for individuals over the age of 60, the endoscopy. Whether the purpose is to examine your esophagus, your stomach, or even your colon, doctors frequently recommend it as a precautionary measure, simply to be safe, and in certain circumstances, this recommendation is entirely logical and warranted. However, here is a critical piece of information that is often left unsaid. If you do not genuinely require the procedure, and especially if it involves the use of sedation, it might, paradoxically, cause more harm than good. To begin with, the vast majority of individuals over the age of 60 regularly taking some form of medication. Blood thinners like warfarin, aspirin, or Plavix are exceedingly common prescriptions, and when you are sedated for an endoscopy, your blood pressure and overall circulation naturally undergo significant changes. Combine this physiological alteration with medications that directly affect your blood's ability to clot, and suddenly you are facing a considerably elevated risk for internal bleeding or, even more concerning, compromised brain circulation problems that could potentially trigger a silent stroke. In 2021, a comprehensive large-scale review, meticulously published in the prestigious journal Gastrointestinal Endoscopy, revealed a significant finding. Among patients over 65 who underwent sedated endoscopy procedures, there was a notable increase in transient ischemic attacks (TIAs), also commonly referred to as mini strokes, within the subsequent 72 hours. These were not necessarily major, debilitating strokes, but they served as undeniable warning signs that something had gone awry with the brain's vital blood flow. One particular case that left a lasting impression involved a 76-year-old woman who had a routine colonoscopy with sedation. She presented with no symptoms whatsoever prior to the procedure. However, 2 days later, she began to experience slurred speech and a noticeable loss of coordination. The emergency room confirmed that she had indeed experienced a mild stroke. The attending physicians believed that the drop in blood pressure during sedation, coupled with her daily aspirin use, may have created precisely the right conditions for a clot to form and travel. Even if the endoscopy procedure itself carries a low inherent risk, the synergistic combination of sedation, advanced age, and various medications can, unfortunately, create a perfect storm of potential complications. Now, this does not mean that you should indiscriminately avoid all endoscopies. However, it emphatically means that you should not agree to undergo one unless your doctor can provide a clear and compelling explanation as to why it is absolutely necessary for you at this specific moment in time. If you are simply being advised to get it because it's been a few years, inquire if there might be a safer, less invasive way to monitor your condition, especially if you are not experiencing any symptoms. Always, without fail, remind your doctor about every medication you are currently taking. Ask them directly, will I need to stop my blood thinner before this? And what are the specific risks of sedation for someone with my particular health profile? Furthermore, if you feel uncomfortable with the idea of full sedation, ask if the procedure can be performed without it, or with lighter, less impactful sedation options. Navigating MRIs and kidney health next, we are going to shift our focus to another medical test that often goes unnoticed or unscrutinized, but it is one that involves an organ many of us rarely even consider in this context: the kidneys. MRIs, or magnetic resonance imaging scans, are undeniably powerful diagnostic tools. They enable doctors to peer deep into the intricate structures of your body, detect early signs of potential trouble, and in some fortunate instances, even help avoid the need for unnecessary surgical interventions. However, when a contrast dye is introduced, typically to obtain even clearer and more detailed images, that is precisely when a heightened level of caution becomes absolutely necessary. This is especially true for older adults, and critically so for those individuals who may have even mild, undiagnosed kidney problems. The contrast dye commonly employed in MR frequently contains gadolinium, a heavy metal. It is not intended to remain within the body. Its design dictates that it should be efficiently flushed out by your kidneys, but here lies the crucial catch. After the age of 60, kidney function naturally and gradually begins to slow down, and if you already have chronic kidney disease, or reduced kidney function that has not yet been formally diagnosed, your body may simply not be able to eliminate the gadolinium as effectively as it should. Over time, even small amounts of this heavy metal can linger within your system. That lingering presence can, unfortunately, be quite dangerous. Gadolinium retention has been definitively linked to a rare, but exceedingly serious condition called nephrogenic systemic fibrosis (NSF), which manifests as a hardening and thickening of the skin and various connective tissues throughout the body. In the most severe cases, NSF can severely limit movement, impede proper breathing, and even lead to critical complications involving internal organs. But here is the particularly concerning aspect that most people remain unaware of. Retained gadolinium has also been detected in brain tissue, and some leading researchers now believe that its presence there may contribute to subtle neurological symptoms like confusion, episodes of dizziness, and disorientation, particularly in individuals who are already at an elevated risk for circulatory issues. A study published in Radiology in 2019 meticulously tracked over 2,000 patients over the age of 65 who received contrast-enhanced MRIs. Within a single week of undergoing the procedure, approximately 5% of these patients reported experiencing stroke-like symptoms, including severe headaches, blurred vision, and problems with balance. While these were not full-blown strokes, they served as undeniable red flags. The majority of these patients also had underlying kidney issues, regardless of whether they had been previously diagnosed. Harold, a 79-year-old veteran from Arizona, sought an MRI after struggling with persistent and debilitating back pain. His doctor ordered the MRI with contrast, simply to be as thorough as possible. Harold had no prior knowledge that his kidneys were weakened. 2 days following the scan, he began to feel lightheaded, weak, and mentally foggy, symptoms that regrettably lingered for nearly an entire week. It was not until his primary care doctor conducted comprehensive lab tests that they discovered he had stage 3 kidney disease. "No one warned me," he recounted with deep regret. "Had I known, I would have asked so many more questions." So, here is what you can proactively do. If your doctor recommends a contrast MRI, directly ask, "Can we perform this without the contrast?" Often, the answer will be yes. If the contrast is genuinely deemed necessary, then unequivocally request a kidney function test first. This is a simple blood test known as AGF or glomerular filtration rate, and it can provide both your doctor and you with invaluable peace of mind. Furthermore, always inform your medical team if you have ever experienced any strange or adverse reactions to imaging tests in the past. Remember, the MRI scan itself is not the problem. The potential issue lies with the additional chemical substance that your body may not be able to handle effectively. By taking the right precautions, you can still obtain the crucial diagnostic answers you need without inadvertently placing your brain or kidneys at unnecessary risk. Rethinking the carotid artery ultrasound next, let us direct our attention to a test that appears utterly harmless, even seemingly intelligent to undergo on a regular basis. However, this test may, in fact, be inadvertently guiding older adults toward risky surgical procedures that they never genuinely needed in the first place. This test is the routine carotid artery ultrasound. It is a non-invasive procedure, typically taking just a few minutes to complete, and it does not involve any needles, injected dyes, or loud, intimidating machinery. On the surface, it sounds like the quintessential preventive test, doesn't it? Yet, here is a critical piece of information that most individuals over the age of 60 are simply unaware of. If you are not experiencing any symptoms, and your doctor is merely ordering this scan as a general checkup, this simple test might, in fact, lead you down a perilous path towards surgery that you never truly required. The carotid arteries are the primary, vital blood vessels responsible for delivering oxygen-rich blood to your brain. Over time, much like many other blood vessels throughout the body, they can naturally develop plaque, small buildups composed of cholesterol or calcium deposits. This is a normal physiological process, particularly as we age. However, it is crucial to understand that not every single bit of plaque needs to be surgically removed. In fact, in a significant number of cases, it is considerably safer to simply monitor the plaque rather than to intervene surgically. Here is precisely where things can go wrong. Let us assume you undergo the test, and it reveals some degree of narrowing within the artery, perhaps a 50% or even a 60% blockage. That sounds inherently frightening, doesn't it? Consequently, your doctor refers you to a vascular surgeon, and suddenly, you are being advised to seriously consider a procedure like a carotid endarterectomy or the insertion of a stent. But if you were experiencing no symptoms whatsoever, no dizziness, no changes in vision, no unexplained weakness, these invasive procedures might offer very little actual benefit, and critically, They carry very real and significant risks. Indeed, a major and highly influential study published in the prestigious New England Journal of Medicine meticulously followed over 3,000 seniors who had moderate carotid narrowing but were entirely asymptomatic. The researchers conclusively found that in many of these cases, surgery did not reduce the stroke risk significantly more than a regimen of medication and consistent lifestyle changes alone. And even more troubling, a small but undeniable percentage of patients who underwent surgery actually experienced strokes, a direct, adverse result of the procedure itself, either during surgery or during the recovery period immediately following. One particularly poignant story that truly resonates comes from Helen, an 82-year-old woman from Pennsylvania. She went in for a routine checkup, felt perfectly fine, and had a carotid ultrasound simply because her doctor wished to be thorough. The skin revealed a 65% narrowing. Tragically, she was sent for surgery within a matter of weeks. Sadly, during the procedure, she suffered a small stroke. She survived the ordeal, but now lives with partial weakness on her right side. She candidly shared, "I sincerely wish I had known that doing nothing might actually have been safer for me." So, what proactive steps should you take? If your doctor suggests a carotid ultrasound and you are not experiencing any symptoms, ask directly, "What exactly are we looking for with this test? And what will be the course of action if we do find something?" Ensure you have a clear understanding of whether the scan is genuinely likely to alter your treatment plan, or if it will simply cause undue worrying and anxiety. If you are already diligently taking blood pressure medications, cholesterol-lowering drugs, and actively maintaining a healthy lifestyle, additional tests may not significantly change your overall management. And if you have already had a scan that revealed some narrowing, don't panic. Instead of immediately considering surgery, inquire about the possibility of repeat scans for monitoring. And always, without exception, seek a second opinion before committing to any vascular procedure. Your health. Your choices. Let us conclude this discussion with some heartfelt advice and a gentle, yet profound, reminder that your health and well-being are ultimately in your own capable hands. So, here is the fundamental bottom line. Not every medical test is inherently dangerous, but it is equally true that not every test is genuinely necessary, especially once you reach the age of 60. Our bodies, with their unique complexities, respond differently to various interventions. What might appear to be a routine procedure, such as the administration of a contrast dye, the use of a sedative, or a simple diagnostic scan, can, in fact, have unforeseen ripple effects that we do not always anticipate. A seemingly simple injection might cause an unexpected spike in your blood pressure. A skin might trigger a reaction. Even a quick checkup can carry risks if your physiological system is already in a vulnerable state. That's why it's so critically important to pause, to ask insightful and probing questions, and to ensure that every single test truly aligns with your specific health needs, rather than merely adhering to a generic checklist or a standardized protocol. You possess every inherent right to speak up, to confidently ask, "Is this test truly essential for my current condition?" And to assert, "Can we explore a safer, equally effective alternative that might be more suitable for me?" Because, without a doubt, informed decisions consistently lead to demonstrably better health outcomes and, perhaps most importantly, to a profound sense of peace of mind. Your unique health story matters immensely. Your voice matters profoundly. And here, we firmly believe that every single choice you make regarding your health should be thoughtfully guided by comprehensive knowledge, rather than being driven by fear or ingrained habit. If you have ever felt strange or unwell after undergoing a scan or a medical test, or if you have witnessed a cherished loved one experience something unexpected and concerning after a procedure, please take a moment to drop a 1 in the comments section below. If you have not had such an experience, kindly post a 0. Let us collectively share our experiences, connect with one another, and learn together from our shared journeys. And if this video has helped you feel even a little more aware, more in control of your health decisions, or simply more curious about your well-being, please consider subscribing to Wellness Hub Seniors. We are here, dedicated to uncovering the truth, unafraid to ask the difficult questions, and always prioritizing your well-being above all else.